we are going to keep moving along here and go straight into our next interview. Then I'm super happy to introduce Bill Taranto, who's the president of Global Health Innovation, who is going to be speaking with Maureen Fura with Mammha, CEO of Mammha. Bill?
Well, thank you. Hello, everybody in the community. I'm really delighted to be talking to Maureen today and really learn about her company. But as always, I like to start out because many people in the audience may not know you, Maureen, and about your history. And the first question is really, if you could tell the audience a little about your journey. How did you start your career, and how did you end up as CEO today of your current company?
Oh, thanks for the great question. It's so great to be here. So thank you for inviting me. I was a graduate student. I was destined. I was on my path to work for the UN and USAID. And then I got pregnant and went and had a mental health crisis. I had never had a mental health complication in my life. And all of a sudden, I was unable to function. And I told every doctor that something was wrong and that I didn't think I was going to make it, and that if I needed help. And I just kept being told, like, you should be happy you're having a baby, and we'll watch it after. And it took me 29 doctors. I kept telling everybody before I was able to find the right help. So that moment really changed my whole life. And I've come to find out, I thought I was allergic to pregnancy, but 20% of women are sensitive to these hormones skyrocketing or dropping off a cliff. And I happen to be one of them. And so that's what led me to, I created a documentary about this. It became a catalyst for creating change, but it wasn't like fast enough. It wasn't addressing the failure points. So something I learned in graduate school was a change in knowledge isn't equal to a change in behavior. So for 10 years, I kept raising awareness, and I wasn't seeing change, the change that we needed. Women were still dying for having a baby. So that's what led me to create Mammha, was looking for a way to close all the gaps, to protect women, to save women, and create a new gold standard of care. So that's my roundabout way of, it was more for necessity, for finding a solution.
Very good. It's a fascinating sort of story, but a very important one, because I think, this company is playing an important role. And with that in mind, can you tell the audience, about Mammha and what you're doing in women's mental health, and how your platform works, and what your products are, and how you actually help women within this space?
Oh, so Mammha is a systems wide solution. We start with providers and we end with patients and women and families. So we've created a streamlined screening mechanism so providers can screen in the office and remote. One of the biggest things we had to address was only 3 to 6% of physicians were actually screening women. So many women were slipping through these big gaps. It's the number one complication of having a baby, but the one that nobody was kind of paying attention to, because what do you do if she screens positive? Where do you send her? So there were all of these liability things. So we fixed that. So now we have providers able to screen, and then if a woman screens positive, Mammha takes care of everything after the positive screen. So we're notified and we step in to do all of the triage. So some people might think this is the way the standard of care is to give her a piece of paper with phone numbers that are outdated. It's like a photocopy of a photocopy of a photocopy. And really that's going at the bottom of her diaper bag or her purse. And maybe she calls it, maybe a number works. Maybe that therapist takes the insurance in the middle of the night when she's, crying and the day's heavy on her. But the vast majority of women don't make that call and they don't get to help. So what we've been able to do is we solved this kind of what happens after. So we've put in place peer support specialists, like care coordinators, who navigate women to care. We follow her through. Average is about 6 weeks, but we've been following women for 10 months if we catch them pregnant. And a lot of people might think, well, therapy or medicine. There's not one path to wellness. And I think that's what we're really doing really well, is that we understand we've been looking at this issue for over a decade under the hood of the healthcare system. So it's not just a one pathway. And that's what we do really well, is we know how to triage her. So we have our own therapists, we have our own prescribers, we have our own support groups, and we do all of that circle back to the provider. So it really gives the provider peace of mind that their patient's being taken care of. And women are 5 times more likely to engage in care when they're screened with Mammha. And that's because we take the disease burden off of her. We're creating this new gold standard. Like when I screened positive for gestational diabetes, and they knew you're going to go to Dr. Chu. Dr. Chu gave me to his nurse. They taught me how to take my blood, how to eat. It's the same new standard. So it's all systemic solution. And it's really working. Women report feeling better on average in 7 days. Not, it took me 120 just to find the right help. So we're really cutting these numbers in half. And then we don't have to send women just to therapy to feel better. It might be a support group. It might just be the peer support. It might be medication. So we're not backlogging therapists. We're saving those for the really complicated kind of cases that come up during that time.
This is a really new learning for me. I was unaware of this until I recently spoke to you, pre this interview. And I'm certainly aware of some of the other issues that occurred during pregnancy, but can you just tell the audience, like, why is maternal mental health just so important, not only to the, woman that's having the child, but maybe even the child, before birth? Can you kind of explain why this is such an important topic?
Totally. Thank you for that question. So besides being super costly, it's the cost price tag is $14.2 billion in the US annually for not treating this, because it impacts mother and baby. So our babies need a responsive mother. They need this kind of goo goo gaga thing going on to help lay down neural pathways. And that sets up literacy. That sets up emotional kind of stuff down the line. So if we can get moms better, then we're impacting generational outcomes. And it's really important. And just think about the spouse, the partner. That person then can't go back to work. They have to carry the load. So it's having all of these impacts that are like coming down the line and hitting your workplace, hitting your community, hitting children's literacy rates. And are they going to have anxiety and depression when they get older? And then it just keeps going on and on, when we can really catch it right at the beginning so that we can change those health outcomes for generations.
Okay, wonderful. So we have a very vast audience, and I represent pharma, but we have other types of companies out there. How does the Hitlab community engage with you and your company if they want to engage with you?
Oh my gosh. So we would love to have partnerships. We're looking for places that want to see how this technology can really close gaps for their providers and their moms and their patients. But also we're entering into our seed round. So if there's like an investor who's looking to really create this new gold standard of care for women that can also fall into new verticals as we grow, like kids and teens and non-perinatal women, then we're really interested in that for sure.
Now you kind of have a really interesting platform, but I want to ask you a broader question about sort of the digital medical community. Where do you see sort of digital medical technology going, in the future? Do you see better engagement coming, from whether it's the provider or the payer or even the patient? There's a lot of different sort of tools being created, but we don't see adoption in everything. I'm just curious to your insights, not only with your own company, but just broadly about digital, medical technology.
I think it's me and my life personally. I think we've seen how technology, leveraging it, can cut down the silos and increase efficiency, and it's more cost effective. So I feel like we're heading in that direction. I feel like the other speaker, CEO from the last segment, and the incentivizing, taking care of your health, and like the gamification of that is just fascinating. And I was even thinking, I have so many women with depression and anxiety right now where I think a lot of it has to do with low iron and low vitamin D, and how hard is it for that woman to go get her blood drawn? Like, can we have some kind of system where she can do that from her home? And so I think just the way that technology can help those inefficiencies so that we're all getting better faster, and we're more aware of what's going on when it's happening, and we can prevent it too, which would be amazing.
Okay, well, thanks so much. I think we're out of time at this point. I see Lisa pop back on, but I really want to thank Maureen and Mammha and what she's doing in women's mental health. And we wish you the best of luck with your company.
So,
Lisa, I'll turn it over to you.
Thank you, Bill. Thank you, Maureen. So good to see you both.
You as well.
Awesome. Well, we've got time for a quick giveaway here. So this was from our speaker earlier this morning. Her book of What We Really Asked Dr. Google, Julia Walsh's book. So this is for the first person with the correct answer. And our question is, in 2025, the global big data market related to healthcare is estimated to increase by how many US dollars? Give that just a second, see all kinds of great answers popping in. And the correct answer is A, 70 billion. So our winner there is El Shadi. I think I'm saying this correct. Please look for someone to reach out to you and give you information on the how you get your book.